South Korea has reported 152 new cases of COVID-19 on Thursday, the first time in 5 days that the number of cases has topped 100. This brings the total number of confirmed cases to 8,565, as the health authorities remain on high alert over cluster infections across the nation. Of the latest cases, 97 were reported in Daegu and 12 in Gyeongsang-Bukdo province. Seoul saw 12 additional cases, and the total number of imported cases rose by 5 to 16. With 7 more deaths reported, the country's death toll now stands at 91. The South Korean government has expanded its special entry procedures to all inbound traffic starting from midnight this Thursday, just 3 days after it implemented tougher quarantine on all arrivals from Europe. Everyone coming into the country will have their temperature checked and fill out health documents at the airport. They also need to provide a verifiable contact number and address while they're here and download a smartphone app they'll use to report their health conditions for 14 days. The briefing's starting now. Let's go to the site.
And here is a briefing by Mr. Kwon Jun-uk. Let us now begin our regular briefing for the coronavirus outbreak here in South Korea as of March 19th, Thursday. As of today, midnight, we have a total of 8,565 cases, and of them, 1,947 have been discharged following full recovery. Our new confirmed cases was 152 from the day before, and the number of discharge was up by 407. So we have saw an increase of those who have been discharged. And by region, Daegu had the largest outbreak with 97, and Gyeongbuk had 12, and Seoul also had 12 new cases. Nationwide, 88.8% was related to cluster infection. And in Seoul, regarding the Gurogu District Call Center, we have identified 4 new cases, and right now the total stands at 139 cases. And in Gyeonggi-do Province, Seongnam City, at the Church of River of Grace, 9 more cases have been confirmed with a total of 64 so far. And also at the Bundang Jaeseng Hospital at Gyeonggi-do Province, Seongnam City, we have 4 new cases. And so far, we have 35 cases so far. And as we saw, the building of the 81, we also saw that on the same building more increased confirmed cases. And we also tested positive for 3 people who visited this building. And also at a hospital in Daegu, we have identified 8 new confirmed cases. And in Daegu, we are currently conducting screenings for the high-risk patients or high-risk potential patients. And we have identified 7 new cases, and we are taking countermeasures. In addition, in Daegu City, we had a very unfortunate death of a 17-year-old boy. And to this, the KCDC would like to send our deepest condolences to the bereaved family and the boy who died yesterday. And a lot of the people also are very concerned about this unfortunate death. And to this, we will carry out objective investigation. Up until now, the KCDC has conducted analysis. And aside from our experts, we also asked the private institutions, private experts to join us. And epidemiological surveys were also conducted. And based on a comprehensive data, we have concluded about the death of the 70-year-old boy in Daegu. Regarding the analysis, in order to carry out very objective analysis, we asked the experts at the SNU hospital and the Yonsei Severance Hospital. And regarding the conclusions, we also had a special committee go over and review the analysis. And this boy was tested negative of the coronavirus. In addition, this morning, we also convened another meeting at the KCDC regarding clinical trials, regarding the death of the 17-year-old boy. We concluded also that he did not die of coronavirus. So we thought and concluded that we don't need autopsy due to this conclusion. And to this, the KCDC, considering the overall outbreak, we see an increase of outbreak in Europe, the US, and the Middle East. We see a great surge. As of midnight on Thursday, we have expanded the special entry procedures to all inbound traffic. And that means that all of those who are flying into South Korea, they need to check their temperature and they need to fill out health documents and they need to verify their contact number and addresses upon their arrival at the airports. And also, they need to download a self-check application to report their health conditions for the next 14 days. And they also need to report their documents about where they traveled overseas to each of the medical facilities. We also urge the rest of the public, because we see a surge in the outbreak globally, we are exerting our full efforts to intensify our screening. However, we still see an increasing number of the important cases. So for those of you who are flying in from abroad, including Europe, the US, and the Middle East, we ask you to stay home for the next 14 days after arrival. And regarding research and development, our National Health Institute is carrying out the clinical test trials as well as the immune system research. And we are right now in the process of designating research institutions, and we will exert our full efforts to implement these research as soon as possible. Regarding the recent outbreak, the KCDC is also focusing on the outbreak that is carried out centering around churches, multi-use facilities, and cluster infections, and especially hospitals as well. And we believe that preemptive measures is very important. In addition, today, specifically, seeing the prolonged coronavirus outbreak, we see that a lot of people are suffering from mental stress regarding coronavirus outbreak. To help them cope with their mental stress, and we would like to provide them with a psychological support center, and some information will be given to you. Please do not be alone, but ask for the help of experts. The KCDC, as well as with the Korean Psychological Association, we have asked 230 experts, and if you call the 1339 call center, you can receive one-on-one consultations with these experts on a daily basis. Also, we also have the Comprehensive Psychological Support Center for COVID-19, which provides professional consultations nationwide, as well as the municipalities and the school offices are also providing online and telephone consultations for those who are suffering from mental stress. So if you are in need of this help, please take use of this. Thank you very much.
And that'll conclude our coverage of this briefing. Stay tuned to Arirang for all the latest on the outbreak in South Korea. We'll be back at the top of the hour. Bye for now.